Hi, this is Jeff Geske with the Fits on the Go blog. I'm here with Dr. Jae Oh, who's one of the expert discussants on the POPE2 trial that was just presented here at ESC 2014. Dr. Oh, thank you so much for joining us. Can you tell us, for those people who weren't at the late breaking session, what is the POPE2 trial?
Jeff, thanks for asking me. POPE2 trial was designed to see whether colchicine therapy was able to reduce amount of pericardial effusion after cardiac surgery once it's developed. And that is the main purpose of the POPE2 trial.
And what did it show?
POPE2 trial, like POPE1 trial, which demonstrated the no benefit of the non-steroidal anti-inflammatory agents for the amount of pericardial effusion, and POPE2 trial using colchicine showed the same result, that the amount of pericardial effusion really did not change much at all compared to the placebo. So it was a negative trial for that particular purpose.
Sure. And then right after that, we saw that the COPS-2 trial showed improvement in post-pericardial syndrome. So when would you use colchicine after cardiac surgery, knowing the results of those two trials?
But I think you have to understand the methodology of the POPE2 trial to answer that, and also the methodology of the COP2 trial, because a POPE2 trial, they identify the pericardial effusion after cardiac surgery, like the 7 to 14 days after the surgery, and so they had to eliminate a lot of patients after cardiac surgery. So there are a lot of patients who had a small effusion, and maybe no effusion, but do have a pericardial syndrome, such as a constrictive physiologies and other things, as you know. And they didn't really include any of those patients in the POPE2 trial. So the only thing POPE2 trial really showed was that when you have a large or moderate degree of pericardial effusion post-operatively, colchicine really doesn't do anything. But the problem is whether colchicine can reduce the post-pericardial syndrome, pain, the constrictive physiologies, subsequent constriction a few years later, atrial fibrillation. Those type of things are really not really known. So COP2 trial right after that, it showed that the same thing, that effusion-wise didn't really change much. When in the colchicine was studied early on, like the pre-operatively for 1 month, but the post-pericardial syndrome in terms of fevers and the chest pains and other things really improved more significantly on the colchicine therapy. So it is hard to give you a definite recommendation when to use a colchicine post-operatively, because it's not an innocent drug. I mean, you can give you a significant gastrointestinal problem sometimes. So I think we need to do more comprehensive clinical trials. That's what we really try to do at Mayo Clinic. We are studying a trial that we should treat everybody pre-operatively and really longer period post-op, and not only looking at the pericardial effusion, but we also have to look at the atrial fibrillation. We also have to look at the hemodynamics. And as you know, we have seen patients who comes with the neck pains up here with no pericardial effusion, but a lot of pleural effusion because of the constrictive pericarditis from this. So I think they are looking at a small portion of the pericardial syndrome after cardiac surgery, but we have a lot more of a global portion, global things that we have to look at, and that's what we like to hope to do at the Mayo Clinic trial, which we're going to start very soon.
Fantastic. Can't wait to see the results from that trial. Thanks so much for joining us, Dr. Oh. You can find more videos at youtube.com/fitsonthego.